Our journey began over 5 years ago with doing behavioral health integration into primary care. And one of the things that we wanted to accomplish is to be more proactive in care. And we do that because what we know is that 20% of kids from the ages of 14 to 18 suffer from a mental health illness. 50% of the population that has a mental health illness can identify that their symptoms were there by the age of 14. Even though we started in primary care, we knew we had to get further uphill. And 3 years ago, we said, let's go into pediatrics. And that's where our journey began. Behavioral health integration is part of your primary care physician or pediatrician's visit. So your child goes in, does a screening tool, or if you request help and your pediatrician needs that support, by one phone call, they contact our team and we are able to do a psychiatric assessment over video. Following that assessment, we get a treatment plan that the primary care physician or the pediatrician will incorporate, and then we get a patient-specific callback protocol where we provide support not only to the child, but to the family members.
With a process like BHI, we're able to reach many more patients at this point and reach multiple clinics all in one day in a way that's much more efficient. And there's a significant importance when it comes to treating a patient holistically. We need to make sure we're addressing medical issues and just physical health when we're trying to help people mentally.
Prior to this program, every patient that was having difficulty beyond just needing a counselor, we would have to refer to psychiatry. This has been a much easier way for us to engage with behavioral health because we have access to behavioral health in our office.
When you think of the process of having to wait on a referral, having to get placed with somewhere that's a long wait list, so to know that we have it, I think other parents just to know that it's there and that it's available and they're here to help.
Well, I think it's amazing that we can do this, and I think it's a way of showing the community that we're committed to serving our patients in this area of their health needs. Of course, we're interested in making sure that their emotional health is also being addressed. So that's part of the whole package of general pediatric care that we seek to offer at Charlotte Pediatric Clinic, and I think in all of our Atrium Health pediatric practices.
One thing that I will always be grateful for is Atrium Health. Primarily it's because they've given us an opportunity to take an idea and do something that is worthwhile, and something that can change lives to our community.
It's made a huge difference. Elise has become a lot more outgoing, just much more willing to kind of try new things and do new things that she would have never done before. She's sleeping much better. She's having better dreams. The whole new child.